When a new resident is admitted to the Veteran Center, the pharmacists do a medication reconciliation and interview the patient to determine their medication needs. We then contact the physician and review the meds that we've identified on admission and obtain approval, a telephone approval, for all of those medications. And in this way, the pharmacy department is doing a proactive medication reconciliation at the time of admission rather than a medication reconciliation that will occur later on. We interact with families on a routine basis. Certainly at the day of admission, the family usually accompanies the patient, and we're able to visit with them and obtain details about their medication history and how they use medications and their preferences. Families may request a medication list, which we can prepare. We attend family meetings and are able to provide information about medications that we're using and why, and decisions that were made around that during those family meetings. And really, any time the family has a concern or an issue, or just wants information, they simply ask the nurse to contact the pharmacist, and we come along at a time we can arrange. The interactions that we have with veterans involve their benefits of medication that they're experiencing, or the side effects that they might be experiencing. We also interview patients here and ask them what concerns they have. We identify drug-related problems concerning various diseases they might have, and propose recommendations or suggestions of what might be used to treat them. We work with a number of other disciplines. For example, the speech-language pathologists and the pharmacists work routinely together to determine what would be the best medication for the person in terms of swallowing. Some medications can't be crushed, and so an alternative has to be identified. And if an alternative isn't available, then some other suggestion has to be made, and we involve the physician to determine what options we can use.